Hey, this video today is about the splenic flexure syndrome. I've made a bunch of videos about it, but I always have some more to say, so I learned something new that it wasn't something new, but it's something I never thought of before for people who have the splenic flexure syndrome who are in my spot. I just wanted to say about my last video that I did there, and today I'm having a kidney stone, so that was happening in my last video and I didn't know it yet. And to the wisdom within, yes, those spirit spouses it goes a lot further than I explained in that video. If you don't have sleep paralysis and you haven't had seen one of these things before, it's impossible for another person to know what it is or to even imagine what they are. So I learned what they were, right? Because I knew what sleep paralysis was. It's like these demonic things in these episodes, and if it wasn't for that woman showing me that information, I would have never known. So this is a splenic flexure syndrome in depth and its incidence. So I've made several of these videos. I have many new thoughts. So what is the incidence with this syndrome anyways? Everywhere I look, I can't find the incidence. Many people think they have it, but they really don't. I think it's rare. I think it is rare. I don't come across many people that have this. So it may be rare, but it could be more common than I think. I don't know. I think it's, I'd probably go with it's probably uncommon. I'm going to share 2 articles in the description box for interest. These are the things I read. Actually, I think I only have one of them, but so I'm going to tell you how mine began and how it affects me and what I used to treat it. So just to give you one reason I keep making splenic flexure syndrome videos, I have other diseases. I have you know, the suicide disease. Have you ever heard of that? I have 4 of them, and I can honestly tell you that even with that, I wish if I could cure just one thing that I suffer with, it would be over those intractable pains. I would choose the splenic flexure syndrome. That's how I'm affected by this. Although some professionals term this to be in the irritable bowel syndrome class of disorders, it's nothing like that. They only classify it like that because it involves excess gas distension, which are the same things. In my own impression, it's worse than Crohn's and colitis because I've read a lot of stuff about all of them. And what I mean is during an attack, so if you're to take the worst attacks of those compared to like an acute attack of the splenic flexure syndrome, this is worse. So this is how mine began. In 2007, I had major surgery. So I had a midline incision cut from my sternum to my pelvis, and I needed extensive bowel resection, which was successful. I need to look up that information from my hospital files because of what I found out. Adhesions formed after the surgery, you know, on the midline incision, called keloid scarring, which is the thickest type of scarring there is. It causes a lot of pain, and that's what I blame the splenic flexure syndrome on, because what else was I supposed to blame it on? Because it was the most obvious thing. The syndrome only began 8 years after my surgery because my adhesions healed. So your adhesions, when you get adhesions after like a surgery or like, you know, an injury, accident, stuff like that, If they're severe, it'll probably take you 5 to 10 years, and when they heal, they start shrinking. So that's what happens. I have so as it heals, it slowly starts to pull and twist and shrink. So I have visible proof. My belly button is now pushed upwards. Like the scar shrunk the midline incision and it pulled it upward. So could this be the cause? Absolutely. Not until reading the second article. I think I only have one of them here, but did I recognize that I may be right and wrong. It could be either or. I never considered that the surgery itself may have been responsible for the lengthening. So in my other splenic flexure syndrome videos, people are saying, hey, yeah, you know what, I had surgery and I have like this big scar, adhesions, and I didn't look more into it. So when you have a bowel resection and they do something to your bowel, they lengthen it. Or sorry, some people naturally might have like a congenital, they may have a longer colon than other people, and it makes it hard to turn up at that splenic flexure. And so also, well, I don't know, when they do surgery they can shorten it. I guess maybe they can lengthen it too. So that's what happened with my colon and my bowel. So I had a successful surgery. I never considered that. Since my surgery in 2007, my abdomen hurt progressively, like acute pain, until 2015. I didn't have the splenic flexure syndrome, but there was a lot of pain. I didn't know what it was. And this is how it started. So I was bedbound in 2015 with other diseases because of another progressive disorder of my spine and another intractable pain disorder. So late at night, a terrible pain, an acute pain, came from my left lower rib, like left lower rib, stomach area on the left side. It was nagging in nature, intractable, and it wouldn't stop. So intractable means it doesn't stop. Please watch this to the end to see how it affects my mood. None of my other pains affect my mood like this one does. It was rough because when I'm making this video right now, it's hard to stay in this shot. I want to move back and forth, not just because of my splenic flexure, other things too, other pains I have, but this, it's super hard to stay still. Where was I? It was rough because I was already unable to walk properly, and now I had to tolerate it night and day on my back, and I couldn't breathe either. My transverse colon was digging into my splenic flexure. You know the tight turn that the colon that travels, so your transverse colon, transverse means across. It must turn to go downward. So you know you have your ascending colon, your stool comes up your ascending colon across, and then it has to go down the descending colon. So most people, that turn at the splenic flexure, it just turns. It's very smooth turn. People with the splenic flexure syndrome, it gets caught up in that flexure and it causes everything behind it to become obstructed. Stuff gets trapped. Causes a lot of colic. So that tight turn is called the splenic flexure. I lost a lot of weight within a single month. So like a person I read yesterday, and why I'm making this video, this person lost 30 pounds in 1 month. I lost a lot of weight because of this. And food can't give me that weight back. For months I used an old style heating pad with no safety shutoff, and I burned my abdomen frequently from falling asleep with it. Nothing helped my situation until an emergency doctor offered me Buscopan. Not until 2017 would it become a regular medication. No matter where I went, nobody knew what it was because I guess it is that uncommon. It has to be because I was complaining correctly. This is a really tough thing to go through. Your diet becomes more restricted than any other diet out there. You can look what you have to avoid with this. It's crazy. Give me a second. I got to catch my breath. So it becomes restricted more than any diet out there. And if I were you, I would look up FODMAP. Look up FODMAP. It's a guide for food. People vary. FODMAP is used for like IBS, Crohn's, colitis, like those types of things, lactose intolerant, that type of stuff. And it varies from person to person. It doesn't mean everyone's going to be the same with every food. Or if you look up the foods that bother you for splenic flexure syndrome, it's going to be different for other people, but it's pretty general. So personally, I can't stay still with this. My transverse colon is digging so hard in my left side that you can never really have a sense of calm and comfort anymore. Medication, you need medication. How it affects a person's mood and personality depends on what else they are suffering with and how they are in the first place psychologically. Some people can tolerate things better than others. The restless feeling of eating and also walking and having the flexure dig and dig and dig more into the flexure make a person appear intense or psychologically restless. I'm sure there were a few times where people thought I was psychologically restless when I wasn't. Eating makes the colon push into the flexure with stool and trap distension, as does walking, which forces the colon to move. So your colon's always in a state of moving, right? But when you walk, that helps you go to the bathroom, helps everyone go to the bathroom. But the more you walk, like if I go for a long walk, like say if I went for a 2-mile walk right now, I don't know what would happen. Like I usually eat a meal, then I go for a walk. And I can come back so much worse. Why? Because I pushed it up into there. It's a brutal cycle, a vicious one that has no cure. That article actually gave me the only hope, you'll read it, in some time, because I didn't think that my colon or bowel may have been changed by length and can be corrected. So I'm not hoping in that, but people with this go doctor to doctor, year to year. This is something that they don't know about. I just went to a GI specialist. She told me she didn't even know what it was. I don't know if she was what I call gaslighting me, so she didn't have to deal with me, but supposedly she had never heard of it. I find it hard to concentrate and focus. The pain travels through my back, through the ribs, not to mention the stomach problems. I'd say this syndrome changed my personality into a restless one. If I didn't have this, I would be calm. I hate traveling in cars because as you're sitting there, it makes it worse into a lazier colon. So the longer you sit with this, like you sit and just do nothing, your colon's going to become lazy. So if you see this video and you hear what I'm saying, you have no excuse now. Keep moving, keep drinking water. The only way I've figured out to stay consistently well is through diet, 2 walks a day to move it through, and water. and you must get your sleep. Constipation, if you don't know how to treat this, it can be horrid. Waiting in a waiting room for hours is difficult. I don't like sitting down with it and resting. Going out for long periods of time is challenging, as is being around people for any length of time, because it's like when I'm around people, I may take my Buscopan, I may feel somewhat good, but then it starts wearing off. I may appear more intense, more uncomfortable. I don't like it. I hate it. So I despise this syndrome. Everything you do with this syndrome affects it, like moving and eating, which is life. Many people don't want to go out because of it, and I guess I'm one of them, but I force myself on 2 walks a day or I go crazy. I wish I could illustrate in a video how it occurs, but I'll explain it. No articles explain what I'm telling you here as a sufferer. No matter the reason it began, the transverse colon must turn at the splenic flexure to let food and stool and to go to the bathroom and gas, distension to get by and have a normal and healthy bowel habit. If you eat the wrong foods, this disorder can get acute quickly. There are many people who have had exploratory surgeries and got very sick because they didn't know what they were dealing with, because the people that they're dealing with don't know what it is. So it can be that bad. It can look that bad to surgeons, to physicians. So the more stool that is in the transverse colon, so say you have your transverse colon is full of stool, the more stool in the transverse colon, the more painful the next attack can get. So imagine your transverse colon as a thick rod of steel. So just imagine that. I don't know, just imagine like a thick bar across your transverse colon. It's like that. That's how I can explain it. Now imagine that thick, that metal rod inside your transverse colon. Imagine it being that hard. Now imagine trying to take a turn with a thick metal rod at that flexure. That's what this syndrome is like. It's brutal. It digs high up because it can't turn, and everything behind it keeps building up, which triggers colic. So when you go to eat and it's up in that flexure, boy, it just keeps pushing and pushing. Everything behind it, you get gastritis in your stomach, you get nausea, you feel like you're going to throw up. When you eat a meal and the transverse colon is digging into it, your stomach hurts, you get chronic, acute, and just chronic colic. Waves of colic occur as you eat and even after. So it doesn't have to be just when you're eating. For me, walking too far can make it like that. The same idea applies when walking. Imagine so even though I give you that illustration of like a thick, like a hard metal rod in your transverse colon, you still have to walk, you have to make it turn, you have to do exercise, but walking is the best. Walking, like going out and walking, not just cardio, I would say going out and walking. I'm acquainted with these abdominal pains very well. I get chronic gallbladder attacks, and I'm having a kidney stone right now. I'm not in the worst of it, but I am. My own symptoms are as follows. Constipation that's refractory, which means so I know how to go to the bathroom properly now, which means difficult to treat, and even diarrhea, nausea, vomiting, weight loss, which can be severe, anxiety, pain through the ribs on the left side, through the back, a hard feeling under the ribs in the colon, so it's like it feels hard as a rock, or like that metal rod, restlessness, stomach problems like gastritis, a feeling of a heart attack because of the anatomical location of the spleen to the heart. So how do you deal with this? First, there's other symptoms too, I'm sure. First seek treatment. For me, it was Buscopan. Without Buscopan, I probably wouldn't eat. Buscopan is also called Hyoscine. That provided me with instant relief. I can't eat without it. Follow a strict diet. You can look on FODMAP. It can give you an idea and play around with it. I know it's hard. FODMAP is a guide for IBS, colitis, Crohn's, and it should include this. It should include it. Drinking plenty of water. Not sodas and alcohol, or you're going to pay. Sip water throughout the day. So sugar and stuff like that and carbs are going to annihilate this syndrome. Find an exercise regimen that in the least includes walking, or you'll suffer that refractory constipation. It took me 4 years to find out exactly what worked, and without 2 walks, I can't go to the bathroom the next day. So that's how intricate this is. If I don't go for 2 walks, I don't go to the bathroom the next day. That's why I'm so into staying well. This is a distressing syndrome, unfortunately. I make these videos because no one else does, and I know what it's like. Just like my gallbladder attacks, Buscopan works without question. It's a colic medication, so it's meant for gallbladder attacks. It's meant for kidney stones, colic, for breathing too, breathlessness. That has no other competitors. In the United States, they don't have it, but they have something similar called Hyoscamine. And the same here. We don't have Hyoscamine here in Canada. I use Dicetel and Buscopan. Maybe you can order, I don't know, through eBay or something. I use Dicetel and Buscopan at each meal. And also a probiotic is advisable. Live a healthy lifestyle, maybe even a stool softener too. Like I use these, Equate stool softener, or just any stool softener. They work quite well. Give me a sec, I gotta catch my breath again. Or you can use something like Restorelax. I just take a little bit of Restorelax at nighttime, like probably half the dose, and I take 2 of those stool softeners. I'm on opiates, so which makes this even harder to deal with, believe me. But I can't avoid opiates because I have so much pain. I'm not advising opiates for the splenic flexure syndrome. I mean, I have intractable pains that are severe. So I would say take a probiotic too. Live a healthy lifestyle above everything else. Also, I use digestive enzymes. Yeah, that's cut in half, but that's just a papaya enzyme. I thought I would read part of this article I'm sharing in the description box. I don't actually, it's not in the description box, it's just, yeah, I will actually. I don't actually think it's common, no matter what a physician says. So I went to the ER once, it wasn't long ago, and she said, what are your conditions? And I was there, and they weren't picking up on my problem. Canada has questionable doctors, I would say. And I heard that the other day too by a reputable website. Because I was there for my gallbladder, and they couldn't find the problem, but I eventually did find it. She said, what are your conditions? And I said, I said the splenic flexure syndrome. I said it's uncommon. She's like, no, it isn't. But she was the same doctor who told me in a meeting that there is no such thing as an ejection fraction for the gallbladder, which was incorrect, and she tried to make me look bad. I don't know. This is just the way doctors are, man. So I don't trust what they say. So this is just something I read. This is congenital, okay? But it's the same idea with people who get surgery. This is what made me realize that it could be just the surgery that did this. So the syndrome of the splenic flexure of the colon is caused by congenital splenic colon curvature with excessively high fixed points. So they're talking about like someone who didn't have surgery, likely a young person, a lengthy transverse colon, and a narrow splenic flexure angle. Prolapse frequently occurs due to the length of the transverse colon. So the longer your transverse colon, the harder it's going to be to turn at that flexure. The high anatomical position of the splenic curvature causes an acute bend of the descending colon, so as it turns downward, resulting in narrowing of the intestinal cavity, which leads to gas or fecal trapping. Clinical manifestations of the syndrome of the splenic flexure lack specificity. You can see already that this article is already saying there's not much information on this. And they include recurrent abdominal pain, bloating, incomplete intestinal obstruction. So if you're not careful, that can happen. And refractory constipation. They're not talking about anything that I said, any of those symptoms. To date, the cause of the splenic curvature syndrome are poorly characterized. The literature suggests that syndrome of the splenic flexure of the colon is more common in elderly women due to gastric sagging, left hydronephrosis, sigmoid colon torsion, and uterine fibroids. However, this syndrome is really rare among children, so I was wrong. I'm gonna have to look up the meaning of congenital again. I thought that means kids, and I'm pretty sure it does. Like that's what you're born with. Here we report a case of a child with syndrome of the splenic flexure of the colon. Okay, so that was it. I'm just gonna share that quickly. But thanks for watching my video. I'm gonna have to relook the meaning of. I'm gonna look it up right now, actually. Give me a second.